Hi, my name is Dr. Adams, and I am going to answer questions about what are the treatments for TMJ. I'm going to review a little bit because I want to talk about what causes TMJ. I have some other videos that really go in a lot of detail about this, but simply TMJ is caused by activation of the nighttime clenching reflex, and the clenching reflex is a defense mechanism to clear the tongue and other soft tissues that have collapsed into the airway. And that happens in deep sleep. The tongue is a very powerful muscle. And when someone gets into deep sleep, the tongue will relax. And this occurs when there's not enough space between the jaws for the tongue to exist. And it occurs in individuals that have small mouths and small nasal passageways. There's literally not enough room for the tongue to fit. So the tongue being a powerful muscle, when it relaxes, will fall back into the airway. And the defense mechanism is for the body to clench to get the tongue up and out of the airway. So therein lies and frames the question, what are the treatments for TMJ? And I'm going to get into the treatments for TMJ that work and the treatments for TMJ that manage the TMJ problem, the ones that can correct the problem, and the ones that just plain and simple do not work. So focus on the problem that TMJ is caused by a small jaws and a tight space where the tongue can't exist. The tongue falls back into the airway. What we're talking about are treatments that actually create more room in the mouth for the tongue. And there's also the issue of the bite. When the jaws are small and the teeth are in tight, the jaws are having to close too far because they're undersized. There will be a lot of tooth clenching, and there's been a lot of focus on the bad bite, and certainly when the teeth are tight and they're crowded and they don't fit well because of a small mouth, that bad bite really is related to the undersize and the underdevelopment in the mouth. So we really want to focus our treatments on things that are going to create more space in the mouth for the tongue and the other tissues to stay in the mouth where they belong and not collapse into the airway. And I myself have found this to be a very personal as well as professional area that means a lot to me. When I was a kid, I had a lot of tooth crowding, and basically what happened to me is I had 4 teeth removed, and I had braces which pulled things back, and that did in fact straighten my teeth, but it permanently shrunk the size of my mouth and really created even less space for my tongue. And surprise, surprise, I've been a clencher ever since. So I do want to say that the #1 treatment that I think will not work, at least on its own, for treating TMJ is orthodontics. Orthodontics are wires. They will not create more room in the mouth. They will, retain things and possibly even retract things. They will bring the teeth and the soft tissue, if anything, further back into the airway. There are other modalities that will create more room in the mouth, and they can be used in combination with orthodontic wires. So that's not to say that wires won't work at all. But there are orthopedic treatments out there, and this is for adults. This is an appliance called a DNA appliance, and basically, I know you can't see it very well here, but I made one of these for myself, and what it will do is it will create more width and more depth to the mouth. It takes anywhere from 1 to 2 years to do, and it's seen on the schedule much like orthodontics, but instead of moving teeth, it actually increases, grows bone, and creates more room in the mouth for the tongue and the soft tissues. It also establishes more height to the jaw, so um, you're not closing your jaws down so far, and it really is a perfect treatment for TMJ. Also, this appliance, if you look at it really closely, um, it has a split down the middle, and it's shaped like a Y. It also looks somewhat like a retainer, so it does a very good job of keeping the front teeth straight as it creates more room. And the other thing that it does is it has an area for the lower teeth to bite upon. So it has a mechanism where you can open and balance the bite as you're making the mouth bigger and wider. So this really is an ideal treatment. This is a treatment that will, simply put, will open and create more room in the mouth, and it will in fact make the airway larger because it'll grow the jawbones out and forward and moving all the soft tissue up and out of the airway. It'll also increase the diameter of all the bone, including the bone and tissue in the airway. It also will balance the bite. You know, we have complete ability to change the bite as things are getting bigger and opening up. So simply put, this device balances the bite and opens the airway. And if this treatment is handled the right way, it can actually correct TMJ, and it actually, if it opens the airway up enough, can in many cases correct obstructive sleep apnea and sleep disorders. There's another appliance that has been out since the 1980s. It's a springy little wire, and I use this a lot for kids. And basically what it does, see these little loops right here? These little loops can be kind of opened up and bent. You know, the dentist will, you know, us dentists, orthodontists, people will bend wires, and we can put pressure and move teeth. In this case, it goes in the mouth. These little loops go over top of the lower molars, and it'll kind of do this. So basically we'll give like a gentle outward pressure, and interestingly enough, as soon as I put this in my mouth, I really feel like there's something in there and I want to play with it. So my tongue pushes upon this ALF appliance, which stands for Advanced Light Wire Functional. I'm not really sure what the advanced means, but it is a light wire which applies a light force, and it utilizes functional forces to do its movement to some extent, and that functional force that it uses to apply pressure and stimulate the movement and growth of bone is the tongue. You know, the tongue is really important, and I find the tongue to be a really interesting thing. The tongue, when a kid's developing, will put pressure on the upper and lower jaws when it's moving properly. You know, it pushes out, stimulates it, and a lot of people have what's referred to as a tied tongue. And I know the tongue does a lot of things, but being a dentist, the main thing that I really like to see the tongue do is not be tied, so it can stimulate and push on the bone as people talk, chew, do different things, and the tongue movement really has almost everything to do with creating the proper proportions and size of the upper and lower jaw. And when the tongue is not doing its job, that is when the tongue is tied, we can see a lot of problems. So the two conditions where people end up with TMJ that I really think occur the most often are just genetics, which is a strong predictor. If you see parents and grandparents with small mouths and crowded teeth, and then you see these, you know, the genetics is a strong one, and where you see tongues that are tied, that, you know, they're tied down to structures they shouldn't be attached to. Simply put, the tongue can't come out and can't swing, can't come out and swing side to side enough. I probably, definitely had some of those problems myself. Let's go over a couple of the treatments that I think might manage the problem. These orthopedic appliances to create more room can actually correct the problem. Appliances that can manage the problem, and I've used a lot of these appliances in the past. I've been a TMJ dentist for over 12 years, and what we would do is we would make bite splints or night guards. And basically what the bite splints and night guards will do is it's a piece of plastic you put in your mouth, and you can adjust the bite on it and get the jaw into a more comfortable position. You can position the jaw a little more forward to get the airway opened up a little bit. And for many people, as long as they're wearing this appliance at nighttime, it can make them feel anywhere from, I'd say, 30 to 70% better with respect to TMJ pain and symptoms. And this DNA appliance has only been out for the last 5 years, so surprise, surprise, I've had a lot of experience doing night guards and bite splints, because that's really about all that was available for people that wanted TMJ treatment. Other than surgery, a lot of times, surgery can be done. Surgery can be done to, you can, break and reset the jaws into a more open position. Thanks again. Have a good day. Bye.